Howdy! Today we are going to talk about dental health in veterinary medicine, brought to you by the Partnership for Environmental Education and Rural Health at Texas A&M University in College Station. Now, animals use their teeth primarily to chew food, catch prey, and in some cases, self-defense. When you take your pet to the vet's office, your vet will look for four things when looking at the teeth. First, they'll look for signs of disease in the teeth and in the gums, broken or missing teeth, occlusional relationships between the teeth, or how the teeth fit together when the mouth is closed, as well as the approximate age of the animal. So vets can tell the age of the animal by looking at the type of tooth. For example, is it a permanent tooth or is it a deciduous tooth? Deciduous meaning a baby tooth, and also how much each tooth has erupted from the gum line. For example, if we were to compare a younger animal with an older animal, a younger animal may have a tooth that just began to erupt, whereas an older animal may have a tooth in the exact same spot that is fully erupted. Now let's take a look at some pictures. So what is the first thing you notice about these teeth? Obviously, the teeth look different as far as shape and size. This is normal adult dentition in a young dog, and this is normal deciduous dentition in a young puppy. You're probably wondering now, do animals get dental disease? And the answer is yes, they do. Animals can get periodontal disease or gum disease, which is a pathological inflammatory condition of the gum and bone support surrounding the teeth. This disease can affect 85% of cats and dogs over 5 years of age. If you look at this image, you can see how periodontal disease can progress over time and it can become very painful for animals. The best way to prevent this from occurring is to clean the teeth, both at home and by the veterinarian, as well as a healthy diet. Veterinarians can also tell if an animal has tooth pain because animals may wince when they touch the mouth or even hit a suspected tooth. Clients may also remark how their pets are not eating as much or spitting out their food. You might be wondering by now, what can dental disease do to my pet? Dental disease is often very painful and can result in tooth loss. They may not eat very much, and as a result, infections can occur. Some clients even note that their pet has become less active, which is often due to the degree of pain the pet is experiencing. Periodontal disease occurs when bacteria forms a plaque on the tooth surface. Plaque can sometimes mineralize or harden to form a calculus on the tooth surface. Plaque starts to touch the gums, so bacteria in the mouth and the immune system release destructive chemicals and degrade the attachment of the tooth to the gums. How can you tell visually if your pet's mouth is healthy? You can start by looking at the gums. Healthy gums should be pink, smooth, and shiny. X-rays can also give you a visual of your pet's dental health. This X-ray on the bottom is normal because the tooth is firmly held in place by alveolar bone. There is a clear distinction among the parts of the tooth, like the crown, the root, and the pulp cavity on the inside, and there is no sign of disease. Stage 1 of periodontal disease often displays signs of red or swollen gums. Look at these two images and notice the plaque on the surface of the tooth and how close it is to the gums, which appear irritated. Stage 2 is where the disease progresses to infection around the teeth and shallow pockets and bone loss become evident, especially in X-rays. If you remember the normal X-ray we looked at, you'll note how the alveolar bone that holds the teeth in place has degraded. So instead of that bright white appearance that we saw in the last X-ray, it looks much more gray in this case. Stages 3 and 4 are the chronic stages of periodontal disease. Deep pockets, severe bone loss, and loose teeth are common clinical signs. The x-rays show, in this case, how much bone loss has occurred, which means the teeth are no longer held in place and are capable of falling out. You might be asking right now, after seeing how bad periodontal disease can get, how can I prevent periodontal disease in my own pets? First off, don't let tartar build up. If you see tartar buildup on your pet's teeth, do something about it. You can also get your pet's teeth checked and professionally cleaned by your veterinarian. You can also brush your own pet's teeth at home using a pet toothpaste, not a human toothpaste, and also allow your pet to chew on bones appropriate for pets. Do not give them chicken bones as they are tiny and a potential choking hazard. Here are some general guidelines on how to brush your pet's teeth at home. First, lift your pet's lips, rub their gums and their teeth, and brush gently with a finger brush or a soft brush. And while you're at it, use pet toothpaste, again, not human toothpaste, on your brush. It's also a good idea to ask your vet to show you how to do it, and also do it with parental supervision. Not to say that you're going to hurt your pet, but it's always a good idea to have a partner, even if you have a gentle pet. Pet toothpaste is sometimes flavored to taste like food, so your pet can cooperate better with toothbrushing. Unlike human toothpaste, it does not contain fluoride, which can be toxic to pets. And instead, it has enzymes, which are molecules that help break down food so bacteria cannot grow in the mouth. While enzymes are a great addition, the downside is that they are target specific, meaning they only break down specific kinds of starches or proteins from food. The manufacturer of the toothpaste may not always explain on the label what kinds of enzymes are in the toothpaste, and how well they work is debatable. If you would like more information on how they affect food, visit our web curriculum modules on digestion in the link below. You can also get pet chew toys from your local pet store or online, which are specifically designed to ensure dental health in your pet. Here are 2 examples of the types of dental chews you can buy for your pet. The first one is CET dual enzyme chews, and the other is CET Hextra chews. They are both made with rawhide, which delivers mechanical action that abrades the plaque from the teeth above the gum line. They also work by interacting with saliva, which produces molecules that eliminate plaque-forming bacteria. You may have seen goat hooves sold in stores as a pet chew. It is strongly recommended you avoid these at all costs, as they can actually break your pet's teeth. A common question clients will ask is, do pets get cavities? The answer is usually not, because unlike humans, pets are not exposed to high sugar diets. Humans, on the other hand, usually get cavities if we don't brush and floss our teeth and if we eat too much sugar. Remember when your dentist told you not to eat too much candy? It's because bacteria feeds off of sugar. Luckily, dental research has paved the way for better technology for things like braces, and laser imaging can be used for diagnosing early-stage periodontal disease as well as treating diseased gums. Even for missing teeth, implants have improved over time thanks to extensive dental research. Alrighty, humans, it is time for a lesson in dental care. Remember to brush after every meal, especially morning and night, and rinse well with mouthwash or water. If you don't brush regularly, there's a risk of bacteria in the mouth irritating the gums and then entering the bloodstream. You may have heard of recent studies that discovered a link between heart disease and how frequently a person flosses. We are about to dive into that more. People with gum diseases are more likely to have hardened arteries, heart attacks, strokes, and even diabetes. Just like how you should have your vet check your pet's teeth, you should be getting your teeth cleaned twice a year at your dentist's office. Here's also a gentle reminder, don't forget to floss. Insert the floss between each pair of teeth and work the floss back and forth, up and down, and all around, and then rinse. If you look at the animation, you'll note even cartoon characters like SpongeBob remember to keep up with flossing. Water picks are also a great way to take care of your teeth by directly spraying between each pair of teeth and each surface. If brushing and flossing don't get rid of all the residue on your teeth, you may need to consider using a water pick as part of your routine. This concludes our presentation on dental health and veterinary medicine. Thank you for watching. Cheers.